Respected faculty and my dear friends, today I will be presenting on my thesis, Predictors for Surgical Outcomes in Stage 4A Retinopathy of Prematurity. The study was done at RPC AIMS. So as we all know, Stage 4A is defined as partial retinal detachment not involving macula, and few studies have been documented in the literature which shows there are favorable surgical outcomes in Stage 4A of ROP. But lacuna is that literature does not distinguish between varied Stage 4A ROP presentations. As we can see in this picture, these are all having different amount of traction, which in this is the most severe traction, but they are all labeled as Stage 4A as the macula was attached. So there is a need to study the entire surgical outcomes across the entire surgical spectrum of Stage 4A ROP. Also, many cases are referred late as opposed to West in our country because of late screening, referral and treatment. So the causes of late presentation needs to be ascertained. So with these objectives, we tried to do the study, and it was a single arm prospective interventional study, and we assessed all the Stage 4A ROP babies who met our inclusion criteria. And the follow-up period after surgery was 12 weeks follow-up. All the babies who met our inclusion criteria underwent 25 gauge lens sparing pars plana vitrectomy with traction release under general anesthesia. And at the end of 12 weeks follow-up, we were able to analyze 61 eyes of 43 babies. So as far as pre-op parameters, most of the babies in our studies had zone 2 ROP, and surprisingly, majority of the eyes, more than 50%, had plus disease at the onset. And regarding preoperative treatment received, approximately 9 of the 61 eyes, that is 16% eyes, did not receive any prior treatment. So this was something shocking, as it could amount to gross medical negligence on the part of the primary ophthalmologist. So we tried to do 25 gauge pars plana lensectomy, pars plana vitrectomy, and approximately majority of the surgeries were unilateral surgeries and 42% were bilateral surgeries. And after initial surgery, we tried to obtain good post-operative outcomes, but there were 19 eyes which required second and third surgery also. So 19 out of 61 eyes, that means around 1/3 of the eyes needed second surgery. And most common post-operative complication for which the second surgery was done was dispersed vitreous bleed, persistent traction. So at the end of 12 weeks, 3 months follow-up, we classified as functional outcome and structural outcome. So as far as structural outcome, the favorable outcome was defined as the retina remains attached, disc macula remains attached, and the traction gets released. So in around 40%, 40 eyes, the ROP regressed. In 15 eyes, there was ROP sequelae, that means the traction was relieved, but there was disc or macular drag. And in 6 eyes, 10% of the eyes, the ROP progressed to advanced stage 5 ROP. So in conclusion, 90%, we were able to obtain 90% favorable outcome, and all eyes fixed and follow light. So we tried to analyze various predictors for post-operative posterior pole attachment, classifying into preoperative systemic and ocular predictors, and we found that gestational age more than 28 weeks have a good preoperative outcome as compared to those who are born less than 28 weeks. Also, the hemoglobin level, if it is more than 10 gram per deciliter, then it showed good postoperative outcome as compared to less than 10. And regarding preoperative ocular predictors, we found interestingly TRD extent, if it is less than 7 clock hours, there were 97.2% chances of getting a good outcome. Also, intraoperatively, need for lensectomy, in 2 cases it was needed due to retrolental high TRD, and it caused poor outcome in those babies. Postoperatively, all the babies that needed resurgery had poor outcome. But interestingly, 71.4% of babies who we operated second time, we were able to save those eyes. So timely resurgery is one of the key message of this presentation. So representatively, postoperatively, pre-op there is extensive traction, and post-op after surgery the traction got relieved with early intervention. So we also analyzed various reasons for advanced ROP and found that late screening was one of the major reasons for the late presentation of ROP, followed by late referral or no treatment. The reasons primary were as the babies are sick, so prolonged NICU care and because of prolonged NICU care, the child was systemically unstable, and that's why there was delay in screening. So conclusion is, the predictors for good outcome in my surgery were bigger babies who have gestational age more than 28 weeks, preoperative hemoglobin more than 10 gram per deciliter, and TRD extent less than 7 clock hours. And predictor for poor outcome, persistent plus disease, inferior TRD, and any need for lancectomy or postoperative vitreous bleed. Thank you.
Thank you.
All the competitors must